Hello everybody, welcome to UroChannel. I had to make a quick change to my upload plan because so many of you have watched and commented on my video about average penis size. Thank you for your support and your input. From the comments it became obvious that many of you don't know what a urologist does when it comes to penile examination techniques. A couple of you even doubted that I see erected penises in my office at all. Boy, are you wrong! I think it's about time that I explain to you one of the most important examination techniques for assessing diseases of penile function. The erect penis is part of this examination and it involves penile injections and doppler ultrasound. Here's the deal. When a patient comes into my office with erectile dysfunction or Peyronie's disease, many times I will need to know hemodynamics. Is there enough blood traveling into the penis to bring about an erection? Is blood unintentionally leaving the penis, representing something we call venous leakage? In Peyronie's disease, I will need to measure the curvature of the erect penis and assess plaque size. To bring about an erection is quite easy. I use one of those. On top there's a tiny and very thin needle, and inside this chamber there is Alprostadil. The device allows me to set the exact dose. I just screw here at the bottom and there's a little window with a changing number telling me the dosage. I then inject the chosen amount of Alprostadil into the penis. Some men are horrified just by thinking about getting injected with a needle into their penis, but in fact I do this at the base, where there is less sensitivity and where it is hardly noticeable. The Alprostadil brings about an erection by widening the penile arteries. It pretty much works in everybody. It's a matter of dosage. With severe venous leakage, no or diminished erections will be seen, however. For my patients, it is hard to understand how this should work. They think they will have to be sexually aroused to have an erection. With Alprostadil or any other of the agents used in urology, this is not the case. It just overrides the psyche and brings about an erection, whether you want it or not. Now the doppler ultrasound comes into play. Over the course of the next 10 to 20 minutes, I will be measuring penile hemodynamics. In the color Doppler mode, I will be able to identify and measure the velocity of blood inside the blood vessels of the penis. Soon after the injection, a widening of the arteries can be seen on ultrasound, and the arterial blood flow increases rapidly. In a flaccid penis, it is around 4 to 6 centimeters per second. Normal velocity for an erecting penis is above 30 to 35 centimeters per second. In fact, it is calculated in centimeters worldwide, not in inches. There is also sound included in the machine, and the heartbeat is clearly audible with a hissing sound. The characteristics of the measured curve as well as the sound change within minutes with the erection progressing. This is because the veins are closing and blood is trapped inside the penis. The hissing disappears and is replaced by a single beat followed by silence. This is also visible in the Doppler curve. The machine calculates the resistance index automatically. I won't bother you with the formula. It is a measure of the peripheral resistance to blood flow inside the penile corpora and is important for assessing venous leakage. It should be above 0.8. In normal erectile function, it normally ends up around 1.0. So all of this helps me to find out what is wrong. It also helps to differentiate whether there is a mere physical problem or if this could be a psychological issue. Because if everything works just fine, psychogenic erectile dysfunction might be the diagnosis here. By now you will have come to understand that this examination is part of my daily routine as a urologist with a specialty in sexual medicine. Every day, year in, year out. I've already done this when today's porn stars weren't even born. And I will be doing this when they have retired for a long time and tomorrow's porn stars are in business. Now you know why I also have seen more erect penises than any porn star. Thanks for watching. Bye bye.